everyone, this is Shanmi. In this video, we are going to learn about what is meant by patient counseling. First of all, definition. Patient counseling means providing the drug-related information, drug or disease, diet-related information to the patients in their layman language. Layman language means understandable language. This information can be given in verbally, or we can give written informations like leaflets. Then stages of the patient counseling. First of all, introduction. We have to review the patient record before starting the counseling. Then we can start the session. First of all, while starting the section, we have to explain about the purpose of the counseling section. Then we have to ask the patient whether they have any time to conduct the counseling. Then we can initially start with the drug related information like any drug allergies, if the patient have any drug allergies, or whether the patient is taking other kinds of medications. Then we can ask about the what is medication, whether the patient is taking what is medications, herbals or alcohol. If the patient is taking these kinds, means we have to explain about the interaction of this drugs or alcohol with the prescribed medications. Then we have to advise them to stop this kinds of medications and alcohol. Then we can say about we can ask any questions whether the patient is understand about this about the introduction section. Second one is counseling contents items. Here only we have to explain about the name of the medications and uses of the medication, for what purpose the medication is prescribed. Then we have to explain about the dosage regimen, which dosage forms and which doses the drugs were prescribed, and duration of the therapy, for how many week or months we have to the patient has to continue the medication. We have to explain about this. Then we can explain about the when the medication will show its effect. Some medications will take some long time to cure the disease, so we have to explain about them. Then we can explain about the storage and when to refill the medications, and we can also say them about do not miss any kinds of doses. What will happen if they miss any doses, like that information. Then we can also say about the side effects. What are the possible side effects which may occur due to the prescribed medications, and how to prevent or manage the side effects. What are the precautions has to be taken, and any kinds of drug interactions, drug food interaction, drug disease interaction. This all explained in this counseling content item section. Then counseling process items. Here we can use the language which was appropriate to the patient, and we can also use any counseling aids like leaflets which was easy for the patient to understand. We can also use images, so that it will be easy for the patient to easily understand and picture it out in their minds. We can also use both the verbal and non-verbal behaviors. Counseling, and then fourth one is counseling conclusion steps. First, we have to check the patient's understanding. So we can ask about the feedback, how the counseling section is went on. Have you understand everything? This kind of questions we can ask. Then we can say everything, summarize everything in a short form. What are the drugs, what are the indications, like all in a short form. Then we can ask the questions. so that we can know whether the patient is understand or not. These are the counseling sections. Thank you.